Hi, welcome to my YouTube channel. Ta-da! Hi everyone, welcome to Farm Talks with Meso, your favorite pharmacy technician. Okay, on today's episode, I'll be tackling PMS slash early pregnancy. PMS means premenstrual symptoms. In this society, most women we confuse PMS and early pregnancy. Is not their fault because most things that happen in PMS happen in pregnancy, in early pregnancy too. What is PMS? It happens in between your ovulation and your period. In between your ovulation and your period. It may come 1 or 2 weeks before your period. Once your period starts, it stops. And what are these symptoms? We have acne, we have breast pain, breast tenderness, we have nausea, we have trouble sleeping, food craving, increase in food cravings, and others. Let's tackle breast pain. Breast pain in PMS and early pregnancy. In PMS, both are similar in the sense that in PMS, your outer area of your breast is bumpy and dense and is very tender, full. Happens like that in early pregnancy, but in early pregnancy the difference is that your nipples are sore. There are sores in each of the nipples, and it's very sensitive to touch in the sense that if someone touches you there, you feel the pain immediately. The pain can come from mild to severe pain in early pregnancy. As the pregnancy gets older, the pains become severe. It depends on your system. As estrogen and progesterone releases into your body system, the pains might turn to severe pains. That's what signifies that you are pregnant. This also happens in PMS, but the difference is that the one in early pregnancy, you have sore, that's wound on around your nipples. So let's move over to the next one, which bleeding. Take note, there is no bleeding in during your premenstrual. When you are seeing your premenstrual symptoms, there is no bleeding, unlike early pregnancy. In early pregnancies, you will see light spotting, which are dark or brown in color. Dark or brown discharge will start coming out from your V part. And this discharge lasts between 10 to 14 days. It lasts between 10 to 14 days. So the difference here is that there is no bleeding in PMS, but there is light spotting. Depending on your system, there is light spotting in early pregnancy. Now let's go over to the next one. So the next one is mood change. Mood change in PMS is it can be frustrating. It can lead to someone becoming depressed. It can lead to depression. Take note, please, if you feel this way, talk to your doctor. In early pregnancy, we also have mood change, mood swing, the joy of imagining when you will meet your baby, your little one. But in PMS, you're just frustrated, you're just having mood change. Nothing exactly is wrong with you. You don't even know what is making you to feel that way. You are just depressed, you are just frustrated, you are feeling anxious unnecessarily. Please talk to your doctor. I've seen this done more harm than good to people. When you feel like this, look for someone to talk to. Even if it's not a specialist, look for a friend, a close friend at that. So the next one, fatigue. So in PMS, you're somewhat tired, you're somehow tired, and most especially you have trouble sleeping. But in pregnancy, you also feel fatigue too, but you sleep, you have enough rest. It usually happens in first trimester. Listen attentively, please. When this happens you see any of these symptoms I mentioned in PMS, you can reduce it. You can even eradicate it by what? Eating well, doing some menstrual cramp exercise, doing some exercises at all that will lessen your body weight, that will help you lessen. You can do yoga too, you can do any of this just for your mental health. So the next one, nausea. Okay, so in PMS there is nothing like nausea or vomiting. This only happens in pregnancy, except if your period comes out very late. You may see symptoms related to nausea, but it is not nausea. Take note. But in pregnancy, early pregnancy, certainly you know that it happens. Vomiting, always lying about, drowsiness, it is certainly going to happen. Okay, so let's go over to the next one, which is food cravings and aversions. Okay, when I mean food cravings, I mean increase in appetite. Okay, in PMS, you crave for chocolate. You see yourself craving for chocolates, things like craving for food, increase in appetite. But in pregnancy, it's not usually like that. You see yourself hating the things you like, but it is related. But you see yourself hating the things you like, having aversions to different smells, things you usually don't like before, craving for things that are unusual. You can also crave more of the things you like, but certainly you have aversions. You'll be averted to certain things, to certain food which you usually don't like before, or you have not tasted before, or you are not used to taking before. Okay, but in PMS, you will see yourself taking more food, more chocolate, more sugary things. Yes, the symptom here is sugary things. You see yourself eating more of sugary things. Okay, let's move on to the next one, with cramping. Okay, so in PMS, you have cramping. This is called dysmenorrhea, which usually happens between 24 to 48 hours before your period. It is a very heavy cramp. It's kind of too much. Not all women have that though, but dysmenorrhea happens between 24 to 48 hours. It happens a day or 2 days to your period. It is one of the PMS, Pre Menstrual Symptoms. Meanwhile, in pregnancy, you have light cramps, just like your period, normal period. But please, if you have any case of pregnancy loss in your family or before, please make sure you talk to your doctor, because it can result in pregnancy loss. Okay, please make sure you talk to your doctor. So that will be all for today's episode, PMS and early pregnancy. I hope this helps you in curbing your anxiety. Am I pregnant or am I not? Thank you, and remain blessed. Please do not forget to subscribe to my YouTube channel, Fam Talks with Meso. Turn on the notification so that you know whenever we drop anything of any sort, which will always and certainly help you. Thank you, and remain blessed. Goodbye. Bye.